Everyone's got a role to play, so it's not a medical model caring for the elderly, caring for the aged, and or caring for anybody for that matter. And I think the biggest challenge can be the confidence within yourself that you're doing enough. And I see that in, particularly junior staff or staff that are not necessarily very, clinically health focused, but it doesn't mean to say their role isn't valuable. So sitting with someone and having a cup of tea or doing their diversional therapy activities is as important as giving insulin. It's about actually knowing a person. So I think the challenges around people feeling, or carers across the board, feeling that they are enough is a challenge. So that self-belief and confidence does lack in a lot of people. I think resourcing is a really big challenge, and a lot of areas, in time, you're doing a lot with a little.
Dementia is a very big issue. I work in the secure dementia wing at my facility, and behaviours are probably the biggest issue that we have. When I first started in the industry, I told myself, firstly, all people are mortal and they're going to die, and it's inevitable. You can't save them, so you just got to accept that death is part of nature. Death is a normal part of everybody's life. We're all going to die sometime or other. You can't help it. You're human, so you like people, and if someone passes away, you miss them, and you grieve in your own way.
There is really a big challenge when you're looking after with dementia residents. People living with dementias are a very complex kind of people. There are days that they are happy, there are days that they're sad, there are days that they are unaware. It's something that you sort of realize, oh yeah, it's kind of, you don't know how to handle that kind of situation. It's very confronting, but then at the same time, you are there to support them as well. That's the reason why you are there. With palliative, in palliative aspects in aged care, I think once you went or you work in aged care, you do realize that this individual have really, the life-limiting diseases that at some point there will be the discussion of dying. And for that reason, as a nurse in an aged care who's looking after with this kind of patient, going into a palliative care, it's a very difficult journey as well. In my perspective, in my experience, I would say that being in that side of care, providing that care, is sort of makes you feel really emotional as well, because you build that relationship with that residents. You've been there looking after them for years and years, and then you've seen them when they are really healthy, when they are capable, and then all of a sudden they can't even look after themselves, and then they are declining, and then you can tell that they're not going to last. So at the end of the day, once they go, it affects me. To be honest, it affects me. You have to have that really big burden inside of you when they go. It's a family. A lot of our residents are a family to me. So yeah.
I was an opera singer, and they would sing to her in cares. And when I actually started working and providing cares for her on my own, I would also sing to her the special song that we all know, "You're My Sunshine." And I could instantly feel that she would relax, and I could hear even a symphony, Doesn't matter if you can't sing, just sing, because she knows how to sing. And it's just a beautiful melody to just hear that she still has the capability, even if she doesn't remember. She knows the lyrics. She will, because she said it so many times. She sang it 1,000,000 times. When she passed away, I went into her room for the first time just a few days before she passed away, and I saw her and I was like, wow, it's so different compared to how it was. And it's amazing how quickly something can change without us noticing. We can't control our bodies sometimes. So it's just daunting. And luckily, I got to say goodbye, which was, I felt it in my heart that it's, either you say it now or you're not going to say it again. So I provided cares, I made her comfortable, and I looked at her and I said, "You're my sunshine." I gave her a kiss on the forehead and I left the room. Sorry. It was good to me that I got to say goodbye at least. I'm a person that doesn't quite often share their emotions, so I do tend to bottle up, I will admit that. I bottle up, but I also talk when I need to, and I find the person that I want to talk to because I know they'll talk back to me, and I know they were also someone that had connection with that resident. So I just reflect that on my own. I remember the times that, we used to talk and we used to just interact and share moments of laughter, and that's really my way of, remembering them and having them in my memory.